If someone suddenly can't talk, if one side of the face droops, or the arm becomes weak, that is an emergency, my friends. It could be stroke, and what should you do first in the first few minutes can save their life, can save their brain. So welcome, I am Dr. Chris Kivia, and on this channel, we make medicine simple and practical. Let us talk about stroke signs and what to do first. What is stroke? Let us ask ourselves. Let's define what stroke is. And this, my friends, is what happens when blood flow to the brain is blocked, or when blood vessel bursts. Either way, if either of them happen, brain cells start dying. And that is what stroke is. In other words, we call it brain attack. How do we know the first signs of stroke? We use the mnemonic FAST. And the easiest way to remember is this mnemonic called FAST. F here stands for face. And here we ask the patient to smile. Ask the patient to smile. If one side droops or cannot move, that is a red flag. Our F is positive. A in the name stands for arm. Ask them to raise both arms. If one arm drifts down or is weak, that's a red flag. S stands for speech. Ask them to repeat a simple sentence like, today is a good day. If speech is loud or is confusing, or they can't speak, or do a swallow, that's a red flag. Then remember time. T also is part of fast. The last letter there is T. And the T stands for time. Time is life. Time is brain. So don't wait for time to pass. This patient should reach the hospital within the next 4.5 hours. So you should choose time. Let's then ask ourselves, what should we do immediately? Now that we know we have this patient and probably they have stroke, what should we do? Here is what we should do first, and do it very fast as I am putting it. Number one, you need to call for help or shout for help, or rush this patient to the hospital if you cannot call for the emergency team to come to where you are. Don't have latitude to have this patient take tea. Don't sleep to say that I'm going to take the patient to the hospital tomorrow. If time goes, you are almost entering the danger zone. Number two, you need to note time these symptoms started. This decides what treatment this patient is going to be given while you reach the hospital. Then you need, number three, to keep this patient safe. Safe in what sense? How the patient sit up. If the patient are lying down, that's dangerous. Have them sit up, and or if they can't sit, have them lie on their side. Lie on their side, and the preferred is left lateral position or right lateral position. On the left side or right side, that's simple. Then if they have tight clothing around their neck, like tie or any tight clothing, ensure that it is loosened clothing. That is to ensure that their airway is open so that they can breathe, they cannot be choked. Number four, you should not give food or water. Sometimes when you get this sick patient, you should not have them swallow. If patient cannot, they are confused, they cannot speak, how do you think they are going to swallow? They cannot swallow. So if they can't swallow, you should not give them food. You should not give them water. Okay. Now, so that's what you should do. You should not. The other thing I'm almost, yeah, you should not give them aspirin, because aspirin is one of the medication that veins the blood. Remember, as we have defined what stroke is, it's where the blood is not flowing to the brain. And there is a clot that is blocking it, or there could be bleeding that is happening. We can't tell which one it is. So you should not rush to give them a blood that is going to make, a drug that is going to make this bleeding worse. If you give aspirin and you don't know what type of stroke it is, it's not safe. So you should defy it. Once you rush them to the hospital, the doctor is going to assess them and is going to have them put on that medication if it is necessary. And this is after they have the brain CT scan done. Number 6, if these patients are unconscious but they are breathing, the recovery position is emphasizing it here again, that you should not forget about it. As you are moving from your side to the hospital, ensure that they are on their lateral position. They are sitting up or they are on their lateral position. And if there's anything that is coming from the mouth, ensure that it's cleared so that it cannot choke them, because you can lose them as early as possible. My friends, as I'm closing this presentation, I want to emphasize that a stroke is treatable, but only and only if you act early. If this video helped you, subscribe for more simple medical lessons that can save life. Medicine made simple, lives made safer. Shalom.